Welcome back for more physiology. This time we're going to deal with skeletal muscles just a little bit, kind of like with bones last time, where the point isn't to take hardcore notes. It's just, let's get a general idea. So for the most part, skeletal muscles move skeletons. There are a few exceptions to that, and that would be when we're dealing with your face, and that's going to actually move skin around or openings like your eyes and your nose and your mouth. But for the most part, we move skeleton around. Seems easy enough. When we name skeletal muscles, what we do is we typically look at one of three things. Sometimes it's a combination. Usually, or among the names, is we can talk about what the thing actually does. So if we have a carpi flexor, that's going to be a muscle that flexes your wrist. It could be a carpal extensor, so it's going to extend your wrist. So we can give it a name, or we can call it an adductor or something along those lines. We could talk about what it looks like. So it could be a two-headed muscle, and we could call it a biceps, or it could be four-sided, so we could call it quadraticus or something like that, or it could look like a rhomboid, so we call it a trapezius or the rhomboids, or we say where it's located. So if we have the flexor carpi radialis muscle, what we're saying is we're going to flex our wrist, but that muscle is going to run along your radius. Or we can make reference to a muscle being the serratus anterior. So it's going to be serrated, it's going to look like a jagged edged knife, and it's on the front of your body. Or we can call it the rectus femoris, which it means it's going straight up and down on your abdomen. So that's the six-pack or the eight-pack. The names tell us where it is, or what they look like, or what they do, which is kind of nice. Whenever we deal with the actions of muscles, they make reference to body planes. So we could take a person, we could split you up into imaginary planes. If I separate you from anterior or not anterior, but superior and inferior, we call that a transverse cut or a transverse plane. If I split you so that you have lefts and rights, rights and lefts, we call that a sagittal cut. And we can make it so this is a sagittal cut, but so straight down the middle. This is a transverse cut. This is a transverse cut. Going through my navel is a transverse cut. We could also do frontal cuts, sometimes called coronal cuts or planes. And that's going to separate anterior from posterior. So I can split myself here, or there. Either case, I'm splitting front from back, anterior from posterior. When we make muscles move according to those planes, what we talk about is not the muscle, but we talk about the joint itself. So the joints are like the shoulders or the elbows or the hips or the knees. Every once in a while we could talk about the arm or the thigh or something like that. But for the most part, we reference articulations. So if we were going to deal with something like an elbow flexor, that would be a muscle that makes your elbow change its angle. If I deal with a shoulder adductor, it's going to change the angle of your shoulder. And these actions, these are some of them, they're not all of them, make reference to the planes. So if you were to look inside of the frontal plane and we were to move up and down in the frontal plane, we call that flexion and extension. So if I were to flex my arm, it would move up in that plane. If I were to flex my shoulder, I would bring my shoulder up. Abduction and adduction make reference to the sagittal plane. So if I were to move away from the sagittal plane, we call that abduction, like if you're being abducted. And if you go back towards the sagittal plane, we call that being adducted. The other ones are kind of weirdos, so like the medial rotations and the horizontal flexions and the circumductions. But if we make reference to the transverse cut, the superior-inferior, we call that a elevation or a depression. So if you were to ask, what in part can your trapezius muscle do, you could say, and you're correct. When we look at muscles, we can actually figure out their actions if I look at two things. First one is I have to look at where they are attached, and second thing is what joint do they traverse, what joint do they move across. The attachment points are called origins and insertions, and the major difference between the origin and the insertion is one of those attachments moves, the other one holds still. The word origin is the attachment point that does not move. So if I look at the biceps brachii, which is shown in the picture. The origin, for our purposes, would be the coracoid process. It also grabs onto that cavity in there called the glenoid cavity, but it originates up in the scapula, and it's going to insert itself on the radial tuberosity, so on the radius. When the muscle is contracting, what it's going to do is hold the scapula in place. That side holds still, but the radius moves up and down. What joint did we cross over? We crossed over the elbow, so the result is we have elbow flexion because we made the angle of the humerus to the radius decrease. One of the things that undoubtedly drove you crazy about naming all the bones and learning bony landmarks is there's a lot of weird landmarks. All of those come about, so like trochanters and tuberosities and epicondyles and things along those lines, all of those come about because muscles are grabbing onto those points using tendons and they're tugging. And as that muscle tugs, it's going to deform the bone. And the bone doesn't want to get damaged, so it gets thicker and thicker according to the lines of stress that it feels. And the result is we get these weird looking bumps. So where did those come from? The muscles actually made them come into existence. So your task is going to be to learn origins, insertions, actions, the name, and if you can visualize, meaning see a picture of some skeletal muscles that you're going to be getting in class.